Hey, glad you could make it. This is the Instrument Resources Manual, or IRM, Chapter 21, Endoscopes and Probes. Okay, to begin with, open up to page 370. And in the introduction, I'm not going to go over every word in this chapter, just so you know. I'm going to focus on things that are extra important. So, to begin with, endoscopes are among the most expensive and difficult to maintain medical devices that are processed by central service. Some of these things can cost as much as a house. It's very important that we clean them properly, handle them properly, and delicately. So, there's something else. It's an ultrasonic probe. Now, these are used by ultrasound technicians to get images of inside the body using ultrasound vibrations. So they're not as complex as flexible endoscopes, but they're definitely delicate, and they require special processing procedures. So look at the picture on the bottom of page 370. This is a flexible endoscope. You see all of these channels and passages through the device. This makes them very challenging to clean. And moving on, there's a flexible endoscope laying down in a coiled position. That's fine for transportation. This is not how they're typically stored. They're typically stored hanging vertically, like just about a 7-foot long hose just hanging there. Okay, processing challenges that are posed by flexible endoscopes. Endoscope lumens are very delicate and they're easily damaged. So cleaning must be done in a manner that does not damage the endoscope. Scratches in the lumens create crevices where bacteria can enter and be very difficult to remove. Inside the scope, in that little straw-like passageway, is very delicate. So we have to make sure that we're using the right brush type that is approved for that scope. We have to be sure that we're not forcing a brush in there. If there happens to be some dried matter inside and we try to push it out with a brush, we could be damaging the inside of the channel. So processing flexible endoscopes is challenging, to say the least. You can get information on how to process a flexible endoscope from the manufacturer. It will tell you step-by-step process, things you want to make sure that you pay attention to. There is additional information available on processing flexible endoscopes. You've heard of ANSI AMI ST79. Well, introducing ST91, which is specifically about flexible endoscopes. There's also the SGNA. They have guidelines and tips. Okay. So flexible endoscopes, they do get dirty when they get used, and they can get materials inside and outside, like feces and mucus, that can be very difficult to remove if it's not cleaned soon enough. So some manufacturers actually require additional processing if an endoscope is not cleaned within the first hour after use. You can get that information from the instructions for use. Endoscopes should be properly pre-cleaned at the point of use. Leak testing. Most endoscopes that you're going to deal with actually do require a leak test. A leak test is very important for the ones that do require it, because if there is a tear in the outer sheath or in the flexing portion of the scope, then water could get inside the scope. Water could get inside the scope and cause some serious damage. Not all flexible endoscopes require a leak test, but the ones that do absolutely do. And look at the top of page 373. This is some examples of what can happen if moisture is allowed to get into a scope. That's corrosion. That's corrosion. I am flipping over to page 374. Now, you should read these pages. I'm going to make some highlights for you. You may have heard of a borescope by now. A borescope. She's using a borescope on page 375 in that top picture. It is a tiny flexible endoscope designed to look inside of a flexible endoscope. You should be properly trained on how to use that so that you know what you're looking for. These are some very cool pictures, I gotta tell you. All right, on page 377. Whenever it's possible and when the manufacturer deems that an endoscope is compatible with a sterilization modality, sterilization should be used because it provides a greater level of safety for patients. Now, because flexible endoscopes are considered to be semi-critical devices, high-level disinfection is usually considered to be good enough. However, sterilization is a level above high-level disinfection. So, when possible, if the instructions allow it and you have the means by which to get it sterile, by all means, get it sterile. The bottom picture on page 377, this is a flexible ureteroscope. I've seen a gajillion of these. Notice a couple things. It's laying in a case that is specifically designed especially for this type of scope. This case is designed for flexible cystoscopes and flexible ureteroscopes. But also notice that card laying, well, should I pick the book up and show you? I think you could probably find it. This card right here. That card is attached to a little chain, which is attached to a little cap. And the little cap is attached to the scope. This is extremely important that that cap is attached to the scope before the scope is wrapped up and sterilized. The scope will get sterilized in a sterilizer that will draw vacuum. And if you do not have that cap on and you don't have, so then you don't have the passageway open, there may be air inside of there, and that air will expand under the vacuum of the sterilizer and cause that scope to explode. Not like a Hollywood explosion, but definitely do some serious damage to the scope. On page 377, it talks about the importance of drying. Bacteria don't thrive in dry conditions. So, read that page. Now, on to ultrasound probes. Ultrasound waves are created by a handheld probe that is known as a transducer. There's a picture of it on page 379. This particular one you're looking at is a transesophageal echocardiogram probe, or T probe. So they actually will stick down the throat of the patient, so that they can get as close to the heart as possible and do an ultrasound on the heart. So transesophageal echocardiogram probe. So these have their own unique cleaning processes. They don't have lumens, so you don't have to clean out a lumen, so that's a good thing. On page 380, read the bullet points. But there's a note on the fourth bullet point. It says, although this does not apply directly to the disinfection process, it is important to inspect for bite marks, which can damage the probe. These things go into a patient's mouth and they could get bite marks on them. So we also there'll be bite guards that guard against that happening. Point of use care for T probes, of course, they have to be cleaned. They have to be handled with care. They can cost between $42,000 and $100,000. You heard that right. How many Mustangs could you buy with $42,000? Well, almost a full nice one. Electrical leakage test and inspection for T probes. So you don't leak test a T probe to see if it's leaking air because it might get water in it, but you do have to do an electrical leak test on a T probe. and that will be done according to the instructions for use. T-probe disinfection procedures. Because T-probes come in contact with mucous membranes, they are considered semi-critical devices that must be, at minimum, high-level disinfected to meet current CDC guidelines. Can you sterilize a T-probe? I would have to look at the instructions for use and then determine if that's possible, if I had the means to do it, and that would be just would be definitely a step above regular high-level disinfection if I'm allowed to do that. Page 382. Cautions to be taken during the cleaning and disinfection of T-probes. So this bullet pointed list gives you some specific precautions that should be taken. Read the list, please. T automated reprocessors. Automated disinfectors are available for T-probes. They exist. Automated disinfectors are available for flexible endoscopes as well. Endocavity probes. These are vaginal probes and rectal probes. Excuse me. So a rectal probe is used rectums, and a vaginal probe is used on vaginas. They are not the same. You do not cross-use them, but you're not going to be using them anyways, right? Okay. We do have a DMS program here, so maybe someday you will. Okay. The bullet points on 385, cautions to be taken during cleaning and disinfection of endocavity probes. Huh, they spelled endocavity wrong in that blue box. That's funny. Okay. I am now on page 386. There are automated disinfectors available for T-probes, and there may be biopsies done along with I'm sorry, I said T-probes, I meant endocavity probes. There are automated disinfectors available. There may be a biopsy transformed during an ultrasound, and because the biopsy needle does penetrate sterile tissue during the procedure, it is classified as a critical device. You remember the non-critical, semi-critical, and critical devices? So if it crosses over into a sterile area, it becomes critical. So those, if they're not disposable, you'd be re-sterilizing them according to the manufacturer's instructions. That's it. That's the end of that chapter for you.